What's up, y'all? It's Celeste. It is 7:39 a.m. and I've been driving for a little over 20 minutes already on my way down to Davie, to Dr. Garramone's office, to have my revision. So I'm going to be driving down and having my revision and then coming right back. So I'm doing a lot of driving today. Current ETA is 10:20 and my appointment is actually at 11:30. So I've got a little bit of buffer room there, which is good because I just passed a big accident that traffic was backed up on the other side, so thankfully it didn't affect me, but I'm sure that's not going to be the only one that I pass on my way down there. But I also want to have time to eat when I get there. I brought a sandwich with me, so hopefully I'll have time for all of these things and I'll get there and everything will go smoothly, but we will see. So I don't think I'm going to necessarily be able to record anything while I'm there, but I will definitely update you as soon as I'm done and let you know how everything went. So I had my revision and I'm back in the car on my way home now, and I know the lighting is terrible. It's probably going to go in and out. Yeah, see, it's gotten dark again. It's because the sun is behind me and the window is over here, so it's trying to adjust for that, and there's nothing I can really do about it because the camera has to be there because it's like strapped to part of my car right now. So I'm sorry about that, but my revision went really well. I went to the office and Dr. Garramone came in and we looked at the different areas on my chest that, like the different little, basically like the ends of both of my scars, and talked about the different things that could be done about them. And based on his recommendation, and I agreed with him, there wasn't really any reason to do anything for the right scar at all. And the inside of the left scar, which is interesting because that was the part that I actually originally thought that I was going to have a revision on, like from the beginning, because that was the part that there was this thicker scar tissue underneath, and that ended up going away pretty much on its own, or well, through massaging and also time. It just went down and it softened a lot, so it ended up not really needing anything. So it was actually the other end of my left scar, the outside end under my arm, that it just has a little bit of like puckering at the end. So we decided that was the only thing that he could really do. And what he did was he actually drew on these areas and showed me what exactly he would do and how it would change things. And then he talked about what the procedure would be, and he said he would use lidocaine and it would burn a little bit, and then he would just cut part of it and then sew it back, basically, which is pretty much what I figured. And like at every step he asked me, like he made sure that was okay with me, like that was like everything to do with it was okay, like even like the burning sensation of the lidocaine. And so I consented to all of that, and so then he cleaned the area and then gave me the lidocaine shot, and I honestly did not even really feel that. Like I could sort of feel that there was a needle, but it didn't really hurt. It was kind of weird because I don't really have a problem with needles in general, but usually I can feel them, and it's painful in the sense of like I understand the experience to be one along the lines of pain, but it's not usually like a bad thing. It's just kind of a thing that lasts for like a second, and it really doesn't bother me. This one, like, I recognized that there was a sensation, sort of, but it wasn't even really painful. It was just like I honestly wasn't even sure he had put the needle in at that point, but he did. And there was sort of a burning sensation when the actual lidocaine went in, but not really. Like, I didn't really feel that very much either. I don't know. It didn't bother me. So after a couple of minutes, it started to feel numb, and he got his little knife and basically just cut the area. And I was sort of trying to watch it because I don't know, I just thought it would be interesting. I couldn't really see it very well because of the way it was situated, but I could sort of see what he was doing, but I couldn't focus on it because like when you turn your head that much, you can't really focus out of the corner of your eye that well. So I could sort of see what he was doing, but not entirely. But basically he just cut a little section, like a little, almost like a little oval shape of skin and tissue out, and then he just sewed it back up. So by removing a little tiny piece like that, it kind of just changes the angle of the scar so that it ends up like, when it folds together, it ends up being flat. You can kind of like, if you have like fabric or something, you can kind of see how that works. The reason that there ends up being dog ears to begin with is because of the way the skin, like the way that they have to do the incision and like curve it and try to make it end up at the very end like actually flat. Like if you've ever sewn anything curved, you understand how difficult that actually is. So what he was doing was basically just fixing the very end of it. So the whole rest of the scar like had already healed, so he didn't have to redo all of that, but just fix the very end. So that's what he did, and after he was done, he sewed it up, and then, well, actually what he did was he like pulled out the piece of skin that he had removed and showed it to me, and it was kind of weird to see that. It was like skin and like a little bit of fat and stuff, and it was weird. It was a very small amount. It wasn't like he removed a lot of anything. So he showed me that, and that was kind of cool. And the whole time he was doing this, by the way, he was like narrating everything he was doing and asking me if everything he was doing was okay, if I was all right and everything. And I told him I appreciated that, and he was like, yeah, I hate when doctors just like do stuff and don't tell you what's going on. And I agree with that so much, and I know I've mentioned that before, that I really appreciate that Dr. Garramone does that, and he will answer any questions that you have. I also just like started asking him questions about different things, and after he stitched me up, he put some steri strips on the new incision, and then just put like a giant band-aid over it, and basically I'm just supposed to let it heal and just wait for the steri strips to fall off on their own, which will probably take like a week or two. So I'm back home now, obviously. It's actually been 2 days since I had my revision. I ended up not finishing talking about it while I was on the drive home because the lighting was terrible and then my battery was about to die, so I will just finish my update here. So for my recovery instructions, basically I just am not supposed to do any lifting or stretching above my head, so no raising my other arm up above my head or anything like that. This arm I can do whatever I want with because I didn't have anything done on that side, but this side I have to be careful with, just kind of like when I had the surgery to begin with, but obviously it's not quite as major because it's not as big of an area and the surgery itself was not as involved, but I am supposed to avoid stretching up or lifting anything up above my head. So kind of bummed about that because I've been making a lot of progress in the last few weeks with my upper body workout stuff. I've been like really pushing myself, so it kind of sucks to be putting a dent in that, but hopefully I'll be able to get back to it pretty soon and I won't lose all my progress, but we'll see. He said that he usually recommends to avoid doing those things for 6 weeks. I think that's kind of just his standard thing because that's also what it was for the original surgery. So I think that was maybe a little overly cautious on his part for this particular thing that I had done because it's not that big of an area, but I do obviously want to avoid stretching the scar or having anything go wrong with the incision coming open or anything like that. He said basically like if I stretched enough that it could kind of come open and it would still heal, it's just that it would heal like after it had opened, so it would end up being wider than it is now. So I do want to avoid that, so I'm going to be careful, but I did, today I did ride the exercise bike, which obviously I don't need to do anything with my arm for that. And also I did use some weights, but I didn't do anything up. So I basically did things like calf raises, just holding the weights, and then I did some like bicep curls and stuff, but I was using a lower weight than I usually do. And like if I started to do anything where I felt anything pulling or like really straining that area, I would stop. But what I was doing was not, I didn't do anything that really affected that area. So I'm going to be cautious and just try to do like a few things so I don't lose all my progress, but also not be too overly ambitious with it, because I do want to be careful about it. And that's pretty much it. Like, I can do regular day-to-day stuff, and I don't need to do anything special with like dressing it or anything like that. It's got the steri strips on it, and once those fall off, it should be pretty much healed. So there's not really anything else I need to do other than just try not to stretch it around, try not to knock things into it or whatever. So as far as how it feels right now, it did start hurting a little bit. Hurting is kind of a strong word. It started feeling a little tender on my drive home, just where I could tell that there was something done there. It was like if you have like a little cut or like a little bruise or something. It wasn't anything major. It just like, it was different than normal basically, but not painful enough that like I needed to take anything for it or anything like that. And since then, it's kind of remained the same. I guess it's maybe gotten a little bit stronger, but mostly it's that it has started itching a little bit as it's healing, which is a good thing. I think it's from that, and then also from like probably from having the steri strips and the Band-Aid over it and stuff, like a little bits from that. But it seems like it mostly is itching in the actual center, like where the actual procedure was done. So I think it's mostly just a matter of it healing and that being a part of the healing process. Two things you might be wondering. One, how long did it take? I was in the office for probably about an hour total. The actual procedure took maybe 10 or 15 minutes. Other than that, it was just like me waiting a little while because I actually did get there early. And then us talking about what he was going to do, and then he did the lidocaine. We had to wait for that to kick in for a few minutes, and then he was getting supplies ready and stuff. So like the actual procedure itself did not actually take very long at all, and really the whole thing didn't take that long. So it was pretty quick and relatively painless, painless at the time, and overall a pretty easy thing to go through. Other thing I know a lot of people are wondering is how much did it cost? And the answer is absolutely nothing. I did not pay anything whatsoever for the revision other than paying for my gas to drive down. But he did not charge anything for his services or for any of the supplies he used or anything like that. It's just part of the cost of the original surgery. It's something that I was wondering for a long time, and it was actually in Ash Hardell's video about their consultation with Dr. Garramone, where it was like an actual recording of their phone call. I know Ash asked about that, and that was the first time that I really had it confirmed for me that it is actually part of the original cost. I'm pretty sure in that Dr. Garramone said that if it's like a major thing where you have to go back to the surgery center, then you have to pay for that, but he still doesn't charge anything. I'm pretty sure that's how it works. Obviously, I would check into that before I counted on it, but that's my understanding of the situation. But because mine was so minor and it was just done in his office, there wasn't any cost to me. So I'll be back in a couple weeks once the steri strips come off and it finishes healing, and I can actually show you a before and after of the revision and how it turned out. So I'll see you then. It's been 9 days since the revision, and the steri strips came off today all the way, so I can finally see what this looks like. And I think it's going to look really good by the end. I can still feel the stitches under there, and there's still some light bruising and some leftover adhesive here, but other than that, it's looking really good, and the scar looks like it's going to heal really nicely. It's much flatter than it was, so I'm really looking forward to seeing what it looks like in maybe another few days or a week or so, and that's when I will conclude this video and let you know how things are going by that point. It's been 2 weeks since the revision, and the part that was cut is obviously a lot darker and fresher looking than the rest of my scar, but it looks like once it heals, it's going to be a nice straight line that just kind of continues on with the scar that was already there, and it's going to be nice and thin as well, so I think it's going to heal up to be pretty seamless with what was already done. I can still feel the stitches under there, but other than that, it's looking and feeling pretty flat and definitely a lot better than it was. So I'm really happy with how it's looking so far, and I'm very glad that I got it done. I feel like it's going to look a lot better. I mean, it already looked pretty good to begin with, but I feel like it looks even better now, and it has gotten rid of that little part that was jutting out that was kind of making me self-conscious. So I'm really looking forward to seeing it once it completely heals and just feeling a lot better about my overall results, which I already felt pretty amazing about. As far as what it's felt like for me, for the first like maybe 2 to 3 days, that area was pretty tender and just kind of felt like, I don't know, a bruise or something. And I never took any pain medication for it, but I did take some Claritin and Benadryl for day and night for itching, because that area did itch quite a bit. But again, that was only for about 2 days. And after that, it pretty much stopped feeling like anything. And it's actually been somewhat hard for me to remember not to raise my arm or anything. Like, obviously for certain things like working out, I am conscious of what I'm doing, so I'm not doing that. But like, I keep having times where I'll just like, without thinking, reach to grab something. Or like at one time I was like sitting at my desk and I just stretched my arms like straight up like I usually do. And then I was like, oh no, I should not have done that. And then another thing is when I'm in bed, I've woken up a few times where I've like been either my arm, the other arm has been like up over my head like this, or I've been like doing the sheets or something like that, and just like totally raising my arm and not realizing it, because it doesn't hurt and because it's not something that I feel really anything like stretching or pulling or anything anymore. It feels pretty well healed at this point, as far as anything internal or anything like major like that. But I am still trying not to stretch it because I don't want the scars to be widened or anything. So it's kind of frustrating, just because it's really hard. It's much harder this time, and it was already hard the first time when I had the main surgery, sometimes to not just do things that I was used to being able to do. But this time it's even harder because there's like no pain and just like no sort of like immediate feedback that my body is giving me, like, no, don't do that. It's just kind of a thing that I have to keep conscious of, because otherwise I'll just be moving all around. But anyway, I am sort of slowly getting back into moving a little bit more. I'm not raising my arm up all the way like this, but I have done some workout stuff where I'm like putting my arm like up to the side and stuff. I'm trying to kind of not do too much with that, because just, even though that's not really stretching too much, it's still kind of like, I don't know, engaging that part of my body that I don't want to do anything I shouldn't be doing. But it's now been 2 weeks, so in the next few weeks, I think I should be able to get back to my normal routine and everything. I did have a few people ask some questions about my revision, and I've already answered all of them, I think, except for one from KV, who wanted to know whether getting a revision was something I discussed with Dr. Garramone at the time of my surgery. And I don't think that it was really mentioned then. There was some stuff about it in the huge stack of consent forms that I had to sign. It didn't really give super explicit information about his revision policy, but as I mentioned previously in the video that Ash Hardell did about their consultation with Dr. Garramone, in that he actually does explain that that revisions are covered as long as you don't have to go back to the surgery center, that he doesn't charge a fee. So that was pretty much the first time I really got any really real information from him about it, sort of secondhand. But I had talked to him on the phone for a few different phone consultations after my surgery regarding different areas of my chest, mostly that middle area. And so we did talk about the possibility of getting a revision at some point, but it wasn't something that I really discussed with him, like actually planning it, because he said that he wouldn't do a revision that soon after surgery anyway, because you have to kind of let everything heal and see how it just heals on its own, which in the case of the middle of my chest actually didn't need a revision. Just by waiting long enough, it kind of fixed itself. So that's why revisions aren't usually done right away. So that was pretty much the extent of my discussion with him. It was something that we talked about multiple times over the course of the year, but it wasn't something that we were necessarily planning toward. It was just like a possibility that we talked about, and I didn't really know all the details of what it would entail or whether there would be a charge for it or anything like that. I was kind of surprised when I actually made my appointment for the revision. I looked on YouTube to see if I could find anybody else talking about getting a revision with Dr. Garramone, just to see like kind of what the process was and everything. And I really couldn't find any. And I don't know if that's just because he does such a good job that not that many people get revisions. I'm sure that's part of it. Also, the fact that a lot of people travel to see him, so probably for most people it's not really worth it to like fly again or whatever to go just to get a revision done, which makes sense. But I was surprised that I couldn't really find any. I don't know if maybe there are some out there and I just missed them, but anyway, hopefully if you were looking for that kind of video, hopefully now this one exists and has been helpful for you. But you can always leave any questions or comments below and I will address them as best I can. Hopefully I've kind of covered all the basics of what the process was like and everything, but I'm always happy to give any more information that I didn't think of myself. If you like this video, give it a thumbs up and subscribe to see more of my future content and hit the notification bell so you don't miss any of my future uploads. Thanks so much for watching and I'll see you guys next time.